Hi, my name is Sean.
And I'm Ashley. Today we will be demonstrating how to perform perineal care on a patient with a Foley catheter. First, perform hand hygiene and put on clean gloves. You will need a pair of non-sterile gloves and a package of Foley wipes. Consider also gathering a dry towel, washcloth, or barrier cream if needed. We will discuss these items later. Open the Foley wipes and remove the first wipe. Gently grasp the shaft of the penis. If the patient is uncircumcised, gently pull back the foreskin. Pinch the catheter right outside the skin to avoid tugging the catheter during cares. Wipe the length of the catheter, moving away from the skin. Stop before reaching the stat lock or securement device. With your next wipe, expose the glans penis and cleanse. If the patient is uncircumcised, return foreskin to its natural position. Next, obtain a new wipe and, if able, have the patient spread their legs. Gently cleanse from the shaft down to the scrotum. Next, obtain a new wipe and cleanse the right side of the groin. Then repeat this on the opposite groin. Be sure to utilize the entire pack of Pericare wipes. Now, consider applying barrier cream for a patient at risk for skin breakdown. Lastly, remove gloves and perform hand hygiene. Now that we've seen how to perform Pericare on a male, we will demonstrate how to perform it on a female. First, perform hand hygiene and put on clean gloves. You will need a pair of non-sterile gloves and a package of Foley wipes. First, open the Foley wipes and remove your first wipe. Starting at the meatal junction, gently cleanse the first 1 to 2 inches of the Foley. Then, stabilize the Foley with your non-dominant hand while cleansing the remainder of the catheter. Stop before reaching the stat lock or securement device. Next, remove a new wipe to cleanse the inner labia. Gently separate the inner labia with the non-dominant hand to expose the urethral and vaginal openings. With the dominant hand, wipe one side from front to back in one smooth stroke. Next, obtain a new wipe and repeat on the other side. Next, remove a new wipe to cleanse the outer labia and the inner thigh. Again, use the non-dominant hand to gently pull back the labia from the thigh. With the dominant hand, carefully wipe front to back between the inner leg and the labia. Grab a new wipe and repeat this procedure on the opposite side. Be sure to utilize the entire Pericare wipe pack during this process. Consider utilizing barrier cream for those patients with skin breakdown. Lastly, remove gloves and perform hand hygiene. After performing Foley care, be sure to document your care in the correct place in the flow sheets. First, ensure your Foley drain is documented on your LDA avatar. Then, find the correct tab in your flow sheets. The tab you click on may be different depending on which unit you work in. For non-ICU units, look for the Assessment tab in your flow sheets. You may have to search for this tab in the search bar if it is not already pinned at the top of your flow sheets. For ICU patients, look for the ICU tab. Again, you may have to search for this in the search bar if it is not already pinned to the top of your flow sheets. Next, scroll to the bottom of your flow sheets until you find the Urinary Drain Foley section. Click on the intervention row under the appropriate time and document Pericare and Catheter performed. Avoid using the light blue bath wipes for Foley catheter cares, as they contain a lotion component which adds to biofilm development. This can increase the risk of a CAUTI. Lastly, Foley care should be performed after initial insertion at least every 8 hours and after every incontinent bowel movement.